So good afternoon, Dr. Robin Jenkins and Dr. Sherika Hill. Thank you for taking time to meet with me on today. This project is for my evaluation class through East Carolina University. And we had a assignment to either one, critique an evaluation, or two, to interview some evaluators. So because I knew two absolutely amazing evaluators in the field, obviously I would pick this particular topic. So I wanted to take the time just to talk with you all so that you can provide us with insight as relates to the field of evaluations or evaluation science. So if you would start out, introduce yourselves, I would appreciate that. So first, I'm gonna pass it to Dr. Jenkins. So Doc.
Oh, I wish you had started with Dr. Hill.
I knew you were gonna say that. That's why I showed you first.
It's against my upbringing. I'm Robin Jenkins. I work at UNC at the Frank Porter Graham Child Development Institute, where we work in a work group called the Impact Center at FPG. We do a host of implementation science and implementation science capacity building projects, some of which include research and evaluation.
All right, thank you, sir. Dr. Hill, if you would introduce yourself.
Hi, I'm going to be a little bit more long-winded and maybe even ask my colleague, Dr. Jenkins, to talk a little bit more about exactly what he does in terms of his work at UNC, because I know he directs an impact center, and I think that is informative for us to understand what that is exactly, because it relates to the evaluative work that we do together, and that's actually how we met. And I think it's a nice bookend that I can pick up to describe my work and background. So, Dr. Jenkins, could you share a little bit more?
Thank you so much.
Trying to be, as psychologists are, parsimonious in this conversation. So the Impact Center is a group of about 19 folks, and we have a sort of a broad portfolio of projects that are designed to translate evidence into practice. And that happens in either helping systems develop the skills they need to bring evidence into them through capacity building with leaders and policy makers, policy directors, policy translators, or actual programs, direct service agencies, intermediate organizations that are trying to translate evidence-supported practices into the work they do every day. Obviously, the reason for that is that science and research teach us that there are some things that, when they're done well, get better outcomes, particularly in human services and social systems. So in all of that, we have a portfolio of people that provide a broad array of activities and skills. Some of them have to do with implementation support. There's a complicated set of competencies that go with how you do that with organizations and agencies. Some of our folks specialize in evaluation, both applied practice program evaluation as well as policy evaluation. Some of our folks specialize in media and networking and communications. And some of our folks specialize in web product development, adult learning, and learning systems. So that's sort of a generic, quick overview of the Impact Center.
That is powerful. As Dr. Hill mentioned, can you tell us how you all connected and the work that connects the two of you, and then she can jump off and give her introduction of who she is.
Well, it was kind of an easy thing because Dr. Hill used to work with UNC and at FPG. And at the time, we were in a shared conversation with our director and with Anita Brown Graham, who is the project lead, the PI, the principal investigator for a My Future NC School of Government, NC Impact, if you will, project focusing on increasing the number of educational attainment credentials in North Carolina. And Anita needed some evaluation support for that project, and in conversation with our director, it came up that Dr. Hill and I might have some space to take that on. And so we agreed to partner and to support Anita and their team over at NC Impact and the My Future NC group in carrying out the evaluation for the Educational Attainment Project.
Perfect. Thank you, sir. Dr. Hill, if you would give us insight into your background and your experience with evaluations.
Thank you. So one of the ways in which Rob and I, or the reason why we were paired up for that project specifically, is because I bring a community engaged approach to research methodologies, which was something that was at the forefront of what NC Impact wanted to do. I have a certification in research methods specific to disparities research, which is kind of rare in the state of North Carolina. And that research is specific about rurality and what does that mean in progressing population level impacts. In terms of that population impact, my discipline is actually slightly different. It's not related specifically to workforce development or even systems transformation. It's focused on health systems in general and building out capacity for mental health care. So my research is rooted in looking at developmental pathways to, it's called developmental psychopathology. So how do mental health disorders evolve over time, starting at birth or even preconception and leading to social adjustment as adults. And that work, I progress it as a faculty member at the Duke School of Medicine. And I also have a joint appointment related to policy because I do feel as though it's the environments that could actually prevent. I mean, I know we don't talk much about prevention as being a course of care for people with mental health conditions, but it is truly our environmental settings for some people that sets them on a trajectory of having poor mental health outcomes, and that can lead to disorders given the other social factors that individuals deal with. My background specifically starts in operations research, where I worked in industry for the first 7 years with a global organization in pharmaceuticals. And then I felt as though treatment really wasn't a calling for me, and I wanted to be a little bit more upstream and started pursuing my academic interest in public health. And so I started with my master's in healthcare administration, trying to understand at an institutional level what can institutions such as hospitals do to change the outcomes or the quality of care or access even for their patients and clients. And then I quickly realized that access is not an issue for institutions. That really has to do with government policy and infrastructure. And so from there, I went on for my PhD in public policy and also a PhD at the same time in maternal and child health. And so bringing those two fields together, I then moved over to better understand the developmental cycle of how mental health conditions evolve over time. And so that's the work that I was doing just prior to meeting Dr. Jenkins, where they needed someone in their child development institute who could liaise with our state government in North Carolina to really promote the health outcomes or optimum development for youth, understanding what that could later mean for workforce development, civic engagement, and even building capacity within our state for just healthy families in general.
Mm-hmm.
And so being brought in this project with him to then evaluate a 10-year initiative of the governor to improve our educational attainment statewide was just a really natural fit, because after getting my PhDs, I've gone on to be a fellow for the NIH to look at ways in which disparities contribute to different outcomes for different groups. And then also trying to understand how policy impacts our epigenetics and how we evolve biologically as humans. That could also be a trajectory into our lived experiences. So I bring kind of that more academic and biomedical science understanding to the conversation of how do policies actually impact us in our embedded biological selves.
Wow, it's so much there, and there's so much that I would want to dig into. but it may get get us off target because I'm sitting here like, how did you, how different is it engaging in the workforce and educational attainment? But I know it's a whole entirely different conversation for another day. But I do want to further have that conversation at some point, which would probably be great for a different audience. But that's really impressive. So thank you guys for being here and taking the time just to share and provide insight and wisdom to me. So I want to jump in and ask the question. Um, my question is it like program evaluation? Is it a science? And if it is, how does it differ from research? And either one of you can jump in and take that.
Go ahead, Dr. Hill.
Yeah, I have a really firm line in definition between research and evaluation. My current job is I lead an organization that's called Family Connects, where we have a national implementation across all of the US. We're in about 23 states and over 50
Wow.
different communities. And what we do as an organization is evaluation. So we take an evidence based program and we implement it according to the local context based off of their resources, assets, and challenges.
Mm-hmm.
And the way in which we implement the programming is evaluated to see how might we improve those processes. All right. And so the evaluation of it is really related to the productivity and the outreach, the number of families that we're able to serve.
Mm-hmm.
Whereas research for me is something very different. The research in, I would say, is where you're trying to quantify what are the population level outcomes, and
Mm-hmm.
outcomes happen on an individual or family level or community level, even. And then the impacts, which are the structural changes or evidence that you're having on systems. And those systems can be the political system, the health system, educational system, the workforce system. Um, and so impacts and outcomes are things that research really tries to quantify and
Okay.
describe it in a way of saying that it is statistically significant. Whereas an evaluation is really a tally or a count to show progress over time and to be used for information for improvement. So for me, that is the delineation. One is about improving the processes so that you get the outputs that you're wanting and that you're
Mm-hmm.
counting those outputs. And research is about outcomes on the individual, family level, or community level, or the impacts for systems. But Dr. Jenkins might have a different perspective because I'm very much not just theoretical, but I'm applied, and I know in the applied sense, some of these things are a bit more murky and they're used interchangeably, and sometimes people do them in parallel or a mashup. So he sees all of the different variations of that, where I'm a bit more classic in my designing, in my thinking around that.
Thank you. Dr. Jenkins, if you could speak to that.
Well, I'll try to be. I'll think about it in a different way. A classic sort of definition of evaluation is that it's an effort to make a judgment about the value, merit, or um, contribution of something, whether it's a policy program or um, it could be anything, it could be a product or anything. But it's evaluation is at its core judgmental. It's designed to help determine the merit of something. Now, there are multiple ways of doing that, and there are multiple ways of thinking about when to do it. You can do it on the front end of a well-developed whatever the it is, so that you can do a pretty rigorous control trial around whether something is working or not. Or you can do it developmentally in such a way as to begin to use evaluation to frame an understanding of what something is happening. That's more of a developmental or an empowerment evaluation approach. There are many there's many different kinds of evaluation as you can spend your hours counting. But at its core, evaluation is about the judgment or of the merit of something. Research is really designed to generate knowledge. It's really designed to help capture questions about new phenomena, theories, and understanding of how the world works in different ways. Research can be done in service to evaluation and vice versa. You can do both at the same time. They're not exclusive. But typically research is designed to build and test theories and refine knowledge. Evaluation is generally designed to decide merit of something.
Okay, good deal. Thank you for that. So as we look at, evaluations, so let's say specific to program evaluations, two questions I have in there. They're not really contingent upon one another. The first question is, when we look at program evaluation, is it truly a science or is it more practice, and can they be separated? And then the second question is, what value do you both believe that a sound program evaluation can bring to like the field of education?
I'm going to let Dr. Jenkins start first this time because you have two questions.
Yeah.
Well, I remember the evaluation as a science question. We might have to revisit this one. It's what happens. You get,
The first question was, and you can answer this quickly because I'm so curious, is evaluation science or is it practice? And then the second one was, what is the value that program evaluation brings to the field of education?
Yeah, to education. Okay. So Michael Quinn Patton, who is just a stalwart leader in the field of evaluation, tackles this in a number of articles that he's written around how people conceptualize evaluation as either science, practice, or both. And the answer is it's both.
Okay.
Evaluation can be done in service to science and can use scientific methods and principles to determine merit. It can also be done as a evaluative or a process tool to improve practice, to define dimensions of, quote, good or bad, what works, what doesn't. The differentiation really shows up in the methods used and the rigor of those methods.
Okay.
So if you apply scientific methods that are designed to generate theory, identify hypotheses, maybe apply probability theory or probability hypothesis testing to determine whether something is falsifiable or not, that's more of a science. You can do that in evaluation, but that's a scientific approach to it. If it's designed to but to more accurately describe how something is adding or not value to what's of interest, then that can be thought of as more of a practice set of questions or inquiry. That's a deep topic. We can talk a lot about that, but I'll stop there and see what Dr. Hill has to say.
For that first question, in terms of is program evaluation is a science or is it practice, I agree with Dr. Jenkins. It's absolutely both. I mean, it's everything that we learn in fifth grade science about what is empirical research. It is an observation of the 5 W's. Who it's about, what it is, when does the phenomenon occur, why is happening, and when is it happening. And I think that is what we do in program evaluation. We're constantly trying to figure out for these programs, or basically, who does it work for? Why does it work for them? When does it work for them? In what setting or where does it work for them? And then ultimately, the what is the program? So that is nailed. And then in terms of the practice, that is really where you have to have some expertise that comes into the room. And for me, expertise isn't necessarily about degrees or disciplines or professionalism. Sometimes it's even lived experience. And how does that inform those observations that you're collecting for that that journal that we've had in 5th grade for our science books, to
Absolutely.
the 5 W's. I mean, the 5 W's.
Awesome. Thank you so much. Dr. Jenkins, what is that? So what does, what's the value, I believe how I've asked the question, I believe initially, does program evaluation have in the field of education? What does it look like?
I heard somebody many years ago offer this, and they were an ED, a doctor in the field of education, who had been participating in their own evaluation practices for many years. This person said, education is perhaps the most evaluated field in the human services, if you think of education as a human service, because it is constantly being scrutinized for a host of questions around curriculum and methodologies and environment and developmental aspects of children and the integration of education into social, emotional aspects of children and families, and how schools interface with communities, school safety, and the role of different actors in the school environment. I mean, there's just so many dimensions. And especially now, schools really are a whole ecology of activities that, 100, 200 years ago, schools were mainly institutions that focused on teaching children, teaching young people. Now they really integrate a host of child development, student support, special needs, gifted, and others with special needs, people who have unique learning interests or challenges. So education requires ongoing learning, ongoing assessment to determine how it can do its work well. And it's a complicated field. So program evaluation in the educational setting is extremely important and adds tremendous value to it in a lot of different ways.
Phenomenal. Is there anything you want to add to that, Dr. Hill?
Not at all. I could not have said it any better.
Phenomenal. Thank you for that. Let me ask a question. So there's so many questions I have, honestly, and I know time is of the essence. If we were to talk about, I asked you this before we recorded earlier, if we were to talk about standards of program evaluation versus the competencies of program evaluation, how would you describe that? So what would be the standards that would guide this practice or this field? And then when we talk about competencies, like what does that look like?
Well, I know Dr. Jenkins has a definition of standards versus competencies, so I'm going to let him address that, but I wanted to just start by saying I'm not really clear when the word standards is used, if it's being conflated with rigor. And that rigor is the strength of evidence of how the evaluation is designed or was designed. And there are different levels to that scrutiny that has to be appreciated. So if standards is used more loosely to define credibility, or if it's an interchangeable word for credibility, then I think it will be worth talking about what or how we establish strength of evidence. But if it's just in a classic sense of standards versus competency, I think Dr. Jenkins does a really great job of defining that. So I'm gonna bunt this over to him, and you can decide after he answers, Angie, if you want me to talk more about the strength of evidence for rigorous evaluations.
Absolutely, thank you. And I do want you to talk about that. And I want the classic definition as well. I'm greedy. So Dr. Jenkins, yes, sir. Can you give that those classic definitions of both?
Well, I don't know that they're classic. I think they're just sort of commonsensical. The American Evaluation Association, AEA, has which is sort of the American sort of professional ally group, if you will, of people who share common interest in program and other forms of evaluation, has a core document that defines competencies and standards. But I want to just step back a minute and suggest that there are no one single set of standards for evaluation.
Okay.
If you're an educational evaluator, there are educational evaluation standards. If you're a public health evaluator, there are public health evaluation standards. And so in Dr. Hill's field, for example, epidemiology and developmental psychopathology, there might be unique standards around those, because each field has a different set of knowledge base and a different set of competencies to gain that knowledge base. So it doesn't make sense to think about standards as being this sort of holistic, all-encompassing set of guidelines or strategies or beliefs around how the field should conduct itself. That said, though, there are some common sense sort of beliefs about core things that should be happening in evaluation. So if you think about standards or competencies, let me just talk about competencies for a second.
Okay.
In the sort of lay language, competencies really have to do with, do you have the mastery of the knowledge and the skills that allow you to professionally practice, right? So I'm trying to lean in here to think about it as a field. A lot of people do a ton of informal evaluation, and you may or may not think about using professional standards when you're doing informal evaluation. For example, you may be in a church environment. You want to know whether the parents that are bringing their children to your childcare, your church-based childcare, are feeling like the services that the church childcare is providing meets their spiritual and early educational needs. So you might want to evaluate the programs and the curricula that the childcare is doing. But you might be able to do that through a series of informal questions. You might just ask parents, how's this working for you? What do you like about this? What's good about it? What's not so good? What would you suggest for improvement? That's evaluation.
Okay.
But it's not tilted towards a professional or a more rigorous set of behaviors or guidelines. So when I'm talking about competencies, I'm talking about professional competencies as defined in the field. These are things that really have to do with evaluator behavior, and they're about engaging evaluators in how they develop their not just proficiency but fluency in the ways of understanding the content knowledge in evaluation and the rigors and the methodologies that are required, and then how you engage with people in different settings to do evaluation effectively. Because as Dr. Hill has already mentioned, you can do community-based participatory evaluation in developing countries with people that don't even speak your language. And you can do it well. And that's a great example of evaluation, but it takes a whole different skill set than it does it if you're doing something that's coming out of a Duke or a Johns Hopkins or something like that. Notice I didn't say UNC. I didn't want to sound too but you get my point. Competencies are behavior mastery, if you will, for the professional skills and knowledge you need for a field. Standards really have to do with the kind of, if you will, minimum expectations, things like rigor, things like methodological understanding, things like equity, fairness, understanding power balances, understanding sort of culture and history and the role that plays in how you do evaluation and how you engage people in the work of evaluation. So there are certain standards that are core to these conversations that each field, education, the government, the Office of Public Program Evaluation in the government has its own standards. CDC has its own program evaluation standards. NIH. So all of these groups have their own standards based on their field of service and their field of interest. And I could go on a long time, but I hope that helps set the grounding for the difference between competencies, which are behavioral expressions of skill, knowledge, and mastery, versus standards, which is how the work is conducted.
That's good. Thank you for that definition. Thank you so much, Dr. Hill.
Yeah, so if I was to go back and talk about the rigor and the strength of evidence, there are different ways in which it's applied. There is sometimes a tension between academic research or evaluation versus community-based participatory, where you're doing a co-creation model with
Hmm.
the individuals who you're working with to understand either the problems or the programs that they would like to have evaluated. That tension, I think, can be very healthy to lend itself to a very rigorous process if you're really being sensitive to the voices that are part of the conversation. So, from an academic standpoint, it's really clear in terms of what's valued and how rigor is built. So, first of all, the larger the study, that means the more participants or perspectives that's included, the more it's appreciated and considered credible. The next step beyond that is if you don't have size, then they would like to have two comparative groups that you can compare and contrast the outcomes or impacts or just the processes from inputs and outputs. So that's another design choice that kind of adds as that next tier up for rigor. And what makes that more credible is that you're able to apply statistics in that comparison to say what's significantly different or the same between these groups. And that helps identify the factors that are either worth focusing on, improving, or considered to be key success factors for that process or for that program in terms of outcomes. The next tier up for that in terms of strength of evidence is when you can change the settings. So where you already have had this statistical or comparative type study and you've done it in multiple different settings or with different populations. And so that increases the credibility. And then ultimately the apex or the top in terms of credibility or strength of evidence, SOE, is when you can pull together multiple studies using that same outcome, if even if it's educational or is it about a specific curriculum or a program, and re what we call assess it all over again. So you would take all of those studies, and if they had, let's say, 1,000 participants each, and you take 10 of them because they were all looking at chronic absenteeism. So now you have a brand new study of 10,000 and you rerun the comparative test for those statistics. And that meta-analysis is considered the golden standard. So that's what we're building evidence towards. So some of our work in terms of program evaluation can really be what's called evidence building. And you get a lot of that on that community participatory side where you're using the intuition and the lived experience of the individuals who are helping you to co-create to inform the practice, right? So you're doing evidence building work at that stage. And then you go from evidence building to evidence generating. And that's when you're doing the comparative designs to evidence base, where you're doing the more pooled research at that meta-analysis level. So that's the staircase to strength of evidence that pertains to rigor in what we consider to be program evaluation.
That is powerful. When you guys are talking, I had a thought and a question more so. So when you are hired to be an evaluator, there's an interest of the hiring entity or body that you're going to evaluate their program, and they're, whether it be for grant purposes, whether it be for just to show if a program is going to be sustainable, whether or not the program has value or merit, as Dr. Jenkins pointed out. How can you best do that with rigor, like you're saying, Dr. Hill, but understanding that you're being hired at the interest of another party? So where is that fine line between meeting the needs of the client and not being influenced by bias to meet the needs of the client? Does that make sense? So what does that look like? Because I know with research is like it is what it is. You're doing research in the hopes of uncovering, discovering, and adding to a body of knowledge, right? Ultimately, you can be hired to do research for a particular cause, but ultimately it's to get the pure essence, or to know what the pure essence of a matter is. But in evaluation, I need you to evaluate my program. Hopefully you're going to tell me that my program is great so that the funders can keep funding it, and so I can get this grant, etc. So talk about that, like that fine dance.
This is an interesting dance. I would love to hear Dr. Jenkins' perspective on the work that we're doing together for My Future NC and the UNC School of Government.
Yes,
because
great, perfect example.
Perspective, I would never be in the room with our community teams, because as an evaluator, I would not want to bias any sort of data collection. But because that's not really the goal of this evaluation in terms of what they're valuing, we're wearing two hats as coaches to teach them how to evaluate themselves. And that is what has made it comfortable for me to be in this role. But if I was doing a standard program evaluation, I would not want to engage with anybody who I would be collecting data from.
Gotcha.
So I'm really curious, though, to hear what Dr. Jenkins has to say about this dance, where you have clients who have a request, and then you also have your own principles as an evaluator.
There's a lot to unpack in this discussion. So I don't know how deep and wide you want to go, Angie, but let me just also comment a minute on your thinking about research. Any enterprise where there is an opportunity to develop knowledge or evaluate the merit of something is fraught with peril around the potential for bias or influence. That's why research has its own set of guidelines around propriety, ethics, accountability, ensuring that people, through professional adherence to these standards and competencies, sort of self-govern around these values of unbiased methodological approaches, declaring conflicts when you find them or you have them, and ensuring that people behave the way they should behave. Does that happen all the time? Absolutely not. There are constantly cases where research is funded. Well, and I just wrote a chapter about that. I'll just tell you, take, for example, COVID-19. The government invested billions of dollars in medical treatment research, right? Inoculations, injections for preventing or treating COVID. Well, they paid the very people that were developing the medications. So there was a huge incentive in doing that internal evaluation research around the clinical trials to fudge the data so that they could come up with the quickest remedy for COVID, get it to market, and start selling that stuff. So there had to be extraordinary controls at multiple levels in terms of the funder, the CDC, an external body of reviewers who could advise all that. So there's tremendous opportunity for bias and influence at every step of the way when research is happening and when translation of that research moves into product development, whether it's an evaluation or a program or a policy. On the evaluation side, we make the distinction between being an internal or an external evaluator, right? So if you're working for an organization and you're evaluating things that organization is doing, then theoretically you're sort of an internal evaluator. If you're hired to come into an environment and evaluate something that you're not part of, then sort of by definition, you're an external evaluator. But in both of those scenarios, you could still be doing unethical and very biased evaluation. So that's why even there's a joint commission, there's a joint committee on standards for educational evaluation, and they address these conversations. They have standards around propriety, how you develop formal agreements, how you attend to human rights and respect, how you pay attention to transparency and disclosure, conflicts of interest, cultural humility, cultural validity. So ethical evaluators adhere to these standards. They talk about these things up front. When they identify a conflict, they declare it. And then they use a lot of peer consultation or other methods to try to figure out the ways how to navigate through that. If they're just after the money, or if there's a secondary gain for them participating in it, you might not hear about it.
Gotcha. That's good. Thank you. Dr. Hill?
He said it all. I mean, I'm not sure if you knew that he's also a lecturer. Doesn't come across sometimes when we're in our sessions with our community partners, but I think you are learning as we go just how much of a well of knowledge he truly is.
I totally agree with that, Dr. Hill. I totally agree. Again, I am humbled and honored to be able to have this conversation with the two of you on this particular topic and at this level. I get to see you in action a couple of times a month, and it's amazing to watch you all engage as evaluators and coaches. And I love the way how you amplified the two in the current role that you are serving with my future, and that helps me in my observation of you guys to know, okay, this is the culture, this is the role that's happening under the guise of coaching. This is the behavior that happens under the guise of evaluation or as an evaluator. And so, as I begin to, go further in my career, just knowing what those two look like, I think that was really great for you to be able to provide that clarity here in this time, in this conversation. And then with Dr. Jenkins providing that very well stated overview as it relates to just the how evaluators are to, I guess, engage in the practice of evaluation and the standards that they're held by. And so it's been amazing. And again, Dr. Jenkins said it before, this conversation could go forever because I have 1,000 questions I can always ask you guys, but I won't do it in this context of this class. And so there's there's actually two questions I have, but I'm gonna just do one final burning question. I think my class would probably really want to hear, beyond me being a geek and just want to know more. Can you all talk about just the value of, no, not the value. That's not the word I want to use. Can you talk about the benefits of choosing to go into the field of evaluation from a professional standpoint or career path?
I'll start. I know Dr. Jenkins has been doing this a lot longer than I have, and I would hope that in his answer he talks about the portfolio of evaluative work that he does, because it's very impressive. For me, this was a no-brainer. It marries both my academic interest and research methodology with community engagement. So not only does it give me the flexibility as an independent consultant of sorts to answer a lot of different questions in a lot of different contexts, which really feeds my curiosity and my need for flexibility as a mother and working professional, and also just the fact that I need to be challenged. Like, I love the messiness of doing community engaged research, but on top of all of those factors, it feeds my need to be a people person. Mm-hmm. And I love just sitting with people to really understand from their perspectives what their needs are and what they perceive the barriers to having them fulfilled, and watching that solution finding unfold through iterative conversations. So that's the real value in it for me, in terms of being a human that feels and have some basic needs, just given the multiple roles I wear. But then on a just purely, how, I don't even know how to put it, just my a career path
Mhm.
standpoint, I like that it's very lucrative.
Mhm.
You can really determine your rate yourself and see how competitive that is, for the skills you bring in, and the different ways in which you could approach the problem or the program evaluation. So that's one aspect of it. But it's just also, even though you're doing the same work, it just feels different in every single project. And
Wow.
the problem is not being able to understand how much effort it is, because it's always takes all of you, but
Mm.
you're only able to budget a certain percent of your full-time availability, whether that's 10% or 20%. And it always is going to be 100%, because it means that much. So that's the struggle that I have personally. It's not an issue of being able to say no, but it is not really being able to judge how much of a lift or time it's going to take, because that's the partnership part of it. And you never really know until you get into the work how much support it's going to take to get to the evaluative piece. Because you that's blinded. I mean,
Mm.
you make a pitch for the work without knowing who are the people that you're going to be working with in
Mhm.
terms of the community, and what do they already know.
Mhm.
So
That's good. Thank you for that. Thank you, Dr. Jenkins.
I'm awestruck by that answer, because I love the passion and the humanity and the humility in the way that she just addressed that,
Mhm.
which is who she is.
Totally.
The the really neat point that she made about the School of Government, the My Future in C evaluation, when you're doing developmental or so-called formative evaluation, if you're engaged in that work by the funder or the agency or the group that's brought you into the conversation, to use evaluation to help define the work, to help define and improve what people are trying to do, that introduces its own bias into the process. It's kind of a positive bias. It
Mhm.
says, go be your best at advocating for what should be a better product.
Mhm.
Help us learn what's working well, what's not working well, and then guide us as an evaluator or as a coach or whatever to make it better, so that it becomes more evaluable, it becomes a better product.
Mhm.
That's essentially the contract we have with My Future NC and the School of Government. So it is a dual role, but in a developmental evaluation, it's a very accepted positive role. And so it doesn't really conflate or cause bias. It's a known bias, if you will, but it's a very positive one.
Mhm.
For me, I got into doing evaluation. I'm a community psychologist by training, and part of community psychology competencies is being able to do competent program evaluation. And so many years ago, as I was beginning my career in community psychology, it centered a lot on empowerment and community-based participatory evaluation. We did a lot of work with communities that were faced with disadvantage and challenge. And we learned a lot about what science says should be good evaluation and what happens in reality.
Okay.
And it's that what happens in reality that Dr. Hill is talking about that gives you passion for doing it in the way that really helps people. There's some evaluation that is almost uh, what's the word I'm looking for? It's almost well, it's clinical, but it's sort of so purified that it's almost stripped of any fun. You go through it and you do the rigor stuff, and even the statistics can be really kind of fun and enlightening. but if you ask the question, are you making a difference? You know, is it helping people? There are some evaluations designed just to improve knowledge, just to strengthen what people know about something in the field. That can be very good for the people that enjoy that kind of evaluation. For me personally, I'm interested in doing evaluation work that really makes the world better, that helps people in a tangible way. And so that's exactly why I do it. So I've been doing evaluation that has usually a formative or a short-term outcome kind of focus for many, many years. I've done program evaluation, I've done process evaluation, I've done qualitative and mixed methods evaluations. I've done anthropological based evaluations where I've lived among people and collected data over time and used those data to inform project and program development. So it's been an incredible journey for me. And I've done formal evaluations where there have been quasi-experimental and experimental design, where there groups of randomly designed or subjects have been randomly assigned to different treatment conditions or different intervention conditions. So it's been a fun journey.
Wow, it sounds like an exciting journey. As a professional, and really just getting ready to step into just this new realm of work by way of, you know, degree completion and by way of the work that I've been introduced to just through my future. I'm optimistic and excited about what lies ahead. And so having conversations like this, I have to be honest, you know, it is for an assignment, but honestly, I'm being selfish in taking taking advantage of the assignment and having the opportunity just to learn from the two of you, because I see every day what you bring to the process that I'm involved with and the value that is bringing to our local communities. I mean, the coaching and the guiding them on how to perfect their practice or to perfect what they're doing so that it can ultimately impact their community is powerful. And so just to be able to hear that, to hear your thinking behind that, to hear the science behind it, to hear the passion behind it, it's really inspiring for me. And so I am so appreciative, and I'm not just, you know, blowing smoke. I'm not just pumping your heads up. You guys know me. I really do appreciate these moments. It's kind of like I whispered this, Sherika and Robin, Doctors Hill and Jenkins.
You were right. You were right the first time.
I ain't there yet for the recording anyway. I whispered to when we were meeting with our particular client yesterday. I whispered to the project manager. I said, and then you guys didn't hear me. I told her, I said, look, in this moment, you don't want to talk as much. I said, when you have people of this caliber in your presence, you want to learn from them. They are experts in what they do. Let them guide the conversation, because, you know, our particular client has a corporate background. So she's used to like getting things done. I mean, she comes out of banking too, right? So it's like that methodical, like, okay, you do this. Okay, next person go. It's like, no, just relax. You be the learner today and allow them to do what they do, because I saw the value in the moment. It's just like, and I told her, I said, if you had Oprah Winfrey or Bill Gates in this room, would you be talking? I literally said that. She was like, you're right. I was like, look, let's learn and grow. And so that's how much I value what you all bring to the work that we do.
Oh, Angie, that's too sweet. Thank you.
Yes, sir. Absolutely. That's how much value that I take away and that you bring to the work, because it's the type of coaching and insights and helping us to, you know, perfect these programs that we're, you know, doing, or this process, that's going to really help bring the change that the governor, you know, signed in place, that my future is stamping to say, hey, we're going to do this work. And so I'm appreciative, and I thank you for that, for all that you are imparting into this process and into my life. So thank you for your time again. And I'm going to end the recording, but I don't want you guys to jump off the call yet. So thank you for your time. Is there any final thoughts that you would like to share before we get off, or before I stop the recording?
Just in terms of, is it a career path and how do you find it? I think that's a really big question. I did not know that you could get paid for being loving to-do lists. And that's essentially what the job is checking off to-do lists in a systematic way, and being really a great listener in terms of how you sequence the order of events. I wish someone had told me this in high school, that there is a job for my personality type. And maybe I would not have gotten so many different careers and worked in so many different fields and would have had that straight line to this, because it's it is lucrative, it is very fulfilling, and it does offer that autonomy and flexibility that I think a lot of people would like, but it's just not necessarily clear of how do you land in a role like this to make this your job. And the ways in which I've seen it marketed is very different from different titles. You don't necessarily see program evaluator. You see other titles like program manager or director of programs, or program specialist or administrative coordinator. Like, there are just so many different terms that mask what a program evaluation job really is. So I just encourage people, and I hope that your classmates also, as they move on and shift to the next role, that they actually take the time to look at jobs, not for their titles, but for the actual activities. And they may find that, oh, this is program evaluation. This is what they're actually hiring for. So that's the last thing I want to end on, because I would not have figured this out for myself. I just have been really fortunate to land in this space.
Perfection. Well stated. Well stated. Dr. Jenkins?
The world is so much better because she's in this space too.
I know, right?
She's really great at it.
Yes, sir.
There are formal channels for entering the evaluation field. Many government agencies, if not most, have some evaluation requirement, whether it's performance monitoring or performance management or outright evaluation. So there are public service pathways into evaluation at multiple state, federal levels. And if you get into the nonprofit world, many, if not most nonprofits, if they get some sort of federal or state assistance or private funding through philanthropy, have an evaluation requirement. The problem with making money in the nonprofit sector is that most funders really don't allocate a ton of money for evaluation. And so you really sort of have to develop a broad list of clients, if you will, or agencies or contracts, to begin to develop a reputation, grow your skills. And the more you do that, the more people invite you into doing these contracts, the more you can begin to make money. But when you first start out, it's like anything else. You sort of have to apply your trade and grow your skills. Same thing in government. They're just sort of set salary ranges for evaluators in government. But as you grow your skills and you become more and more known for your competence, and I don't necessarily just mean evaluation rigor and methodologies and those things that could be thought of as evaluation skills. I'm really also talking about the soft skills that Sherika was just talking about. People are much more willing to work with an evaluator that has the patience to understand their context. They want to know that they're working with somebody who really gets what they're wrestling with when they have to deliver something. The constraints, the barriers, the challenges, but also the good things they're doing to tell their story. Those things all matter. And so really great evaluators have a way about joining with groups, whether they're informal community groups or high level government groups, to meet them where they're at, to understand their culture, and to be able to span all those boundaries in really effective ways to deliver a high quality evaluation. Dr. Hill is one of those people. That's why it is a practice where she's so successful at it. Other people come in with a preset idea. No, we do evaluation this way, and they are less successful. Frankly, they are the ones, they might get a contract or so, but once they do their business, they don't often get invited back. So it's really about joining people where they're at and understanding how to blend the science and the practice with what people really need to tell their story. And if you do that well, you can really have a great career.
Phenomenal. Thank you so much. Thank you for those two very well stated endpoints. So you've given me much to think about, and I'm sure that you've given the class a lot to think about as relates to program evaluation as a career path, and just the opportunities that are available for us as we matriculate through this program. So thank you guys. And we're going to stop recording here.